Okay, so in Chapter 9, we're going to talk about stress and adaptation. So in order to talk about stress, we have to first start out with this idea of homeostasis. So in previous anatomy and physiology classes, we learned about how homeostasis refers to internal balance. So the body and the organ systems require a level of balance and constancy to be maintained in order for things to work properly. So homeostasis is this state of internal balance that's maintained by your organ systems. And the reason why your internal states can change is that you're exposed to varying external conditions, which can also affect your internal environment. So an example of which your body needs to keep some internal environment stable would be things like water balance and weight, blood glucose, and temperature. And these are all physiological variables that we want to maintain, fairly constant balance for. So in the last chapter, we talked about water balance. We've also talked about blood glucose balance in the endocrine system. Body temperature and weight also need to be maintained in balance. And so we have various organ systems that help maintain normal balance of these variables. So in terms of homeostasis, this is typically achieved by negative feedback control mechanisms. So if y'all remember, negative feedback was a process that acts to reduce or limit the amount of change in a system. And so what we see here is for blood glucose regulation, we have two opposing negative feedback loops that help keep us within balance or homeostasis. So we need to start somewhere, and we'll start here with a decrease in blood glucose. So let's say if your blood glucose levels are too low, the glucose sensors in the beta cells of our pancreas then would actually prevent the release of insulin. In fact, we actually would get an increase in the release of glucagon that acts to increase blood glucose. And then what happens is if your blood glucose levels get too high, then we have the same glucose sensors in the beta cells of your pancreas that can actually stimulate the release of insulin, which can decrease your blood glucose. So you can see that it kind of goes in this loop here. But ultimately, as our blood sugar levels sort of are maintained by this loop, we see that we're going to be within this average of a decrease and increase, and that average would be the normal homeostatic level, which would be about 100 milligrams per deciliter of blood glucose. So in terms of how we adapt to stress, we call this the general adaptation syndrome, and also called the generalized stress response. And this general adaptation syndrome or generalized stress response, it utilizes a series of different hormones. So some of the hormones that come into play with a stress response are things like corticotropin releasing hormone, which comes from your hypothalamus. We have antidiuretic hormone that also comes from the hypothalamus, but it's released by the posterior pituitary gland. Our sympathetic nervous system plays a role with the stress response, as does our Renin-Angiotensin-Aldosterone mechanism, or RAAS pathway. So stressor is anything that can cause a change to the internal environment of the body. And so stressors could be physical, they could be psychological, and oftentimes our bodies can present with certain signs and symptoms of these changes. With respect to things like water balance, if you lack enough water, there's different signs and symptoms that are associated with dehydration. And that dehydration in and of itself is a stressor for your body. So what happens here is that the general adaptation response helps maintain normal function in spite of that stressor. So we see that in response to the stressor or the internal change, we're going to have some sort of adaptive response to that stressor. So with respect to the psychological differences, we talked about allostasis. And allostasis is the difference between perceived situation and a desired situation. And so if your perception of that situation differs than what's desired, then you're going to take action, right? So for instance, if you feel like you're hungry, but you're not able to seek out food, then you're going to take action to find food. And that's what we call allostasis, which is sort of your adaptation to your circumstance there. And this can lead to a stress response. And in fact, what determines the degree of stress response is this cognitive activation theory. So if your perceived and desired situations are something that you perceive as more life-threatening or more serious, then it's going to be more stressful for you to accommodate that response. So the first type of response we'll talk about here is the sympathetic or fight or flight response. So if y'all remember going back to anatomy and physiology, we talked about how the sympathetic nervous system was your fight-flight response. It's mediated by a system of nerves that mostly originate from the thoracic spinal cord. and it's involved with rapid responses to trauma or emergency. That's why it's the fight or flight response. So we talked about how the sympathetic nerves release norepinephrine from the nerve terminals on their effector organs, and that epinephrine and norepinephrine are actually co-released by the adrenal medulla pathway. So what happens is that these particular hormones, they circulate through the bloodstream and they bind with the adrenergic receptors on the target organs. So we have alpha and beta adrenergic receptors, and depending on the organ, then we're going to see a particular response to these particular hormones. So for one, like the sympathetic response helps to increase blood pressure. We're going to see a decrease in blood flow to skin, your digestive organs, as well as your kidneys. So that due to a sympathetic response, you're going to see that the skin becomes pale, urine production decreases, and GI activity also decreases. So what this would present in someone with acute stress is that they'd have pallor of their skin. Their skin's also going to be kind of cold and clammy, and they're also going to be kind of sweaty from the sympathetic response. They're going to have low urine output, as well as decreased bowel sounds because their GI activity is going to be inhibited by their sympathetic nervous system. So one other system we'll talk about here is the cortisol system, which is we talk about this as being the stress hormone. So we said that it starts here in the hypothalamus with the release of CRH. Because the hypothalamus is associated with like the visceral responses to emotion, what you find then is that your psychological feeling of stress could lead to the release of corticotropin releasing hormone by your hypothalamus. Now what CRH does is it travels in the bloodstream and it excites the anterior pituitary to release ACTH, which is adrenocorticotropic hormone. Now ACTH travels in the bloodstream and then goes to the adrenal cortex where it stimulates the secretion of cortisol, which is a glucocorticoid, as well as some of the gonatocorticoids, which are androgens. Now, because we think about cortisol as being the stress hormone, we see then it alters glucose, fat, and protein metabolism, and chronically it actually suppresses your immune response. This is one of the reasons why we talk about how if you're stressed, that can put you at risk for infection. Now, because it helps regulate the stress response, the way it does this is that cortisol acts to increase the concentrations of free fatty acids and glucose in the bloodstream, which basically diverts your metabolism from building tissues to releasing energy in the bloodstream such that your body's cells that are participating in the stress response have more energy to do so. And so, acutely, you're going to see an increase in blood sugar and free fatty acids. Chronically, there's different signs and symptoms that are associated with chronic stress. So if you're chronically diverting metabolism from building tissues, over time, you're going to see that there's a degradation of tissues. So a lot of times what you'll see then with excessive stress is protein and muscle wasting due to this cortisol response. Now, ultimately, it leads to the increase in blood glucose, which makes sense in terms of providing the energy that your nervous system and your muscle need to carry out the stress response. And the stronger sympathetic system has an effect on heart rate in the presence of cortisol. So if your cortisol is elevated and you have a sympathetic response, you're going to have an even stronger effect on both blood glucose and heart rate. Now, cortisol also decreases non-essential energy use like hormone production, metabolic rate, bone formation, red and white blood cell production. And this is what associates to the immunosuppression of chronic cortisol release because you're not getting as many leukocytes being produced. Now, this question here says, why does cortisol production result in increased blood glucose levels? Well, earlier we talked about how glucose is a nutrient that can provide your cells with some energy. So glucose may lead to a stronger sympathetic nervous system response because it can provide energy to the organs that need it. It doesn't directly stimulate the production of red blood cells, and glucose also doesn't stimulate the release of adrenaline. But glucose, in its truest sense, does provide some chemical energy for your body's cells. So the best answer here is D, that it provides energy. Because by keeping your blood glucose levels elevated, you can help to basically, provide the chemical energy that your muscles need to, outrun that bear, or provide the chemical energy that your muscles need and your nervous system needs to, think of a complex task while also, moving your body around in a way that helps you survive. So this Renin-Angiotensin-Aldosterone Pathway is the RAAS system, And we talked about how this was mostly involved with blood pressure regulation. Now it's activated by your sympathetic nervous system, as well as a decrease in blood flow to the kidneys. So we talked about that when your sympathetic nervous system is active, it actually leads to vasoconstriction. And so by decreasing blood flow to the kidneys, ultimately what happens is that your kidneys release a hormone called renin. Now, through a series of biochemical mechanisms, it leads to the production of something called angiotensin II. So angiotensin II is a hormone that is activated by an enzyme called ACE, which converts angiotensin 1 into 2. And angiotensin 1 comes from angiotensinogen, which is activated by renin, which comes from the kidneys. So that's sort of the effect there. But angiotensin 2 is a strong vasoconstrictor, so this is going to keep your blood pressure elevated during the stress response. Angiotensin 2 also stimulates cells of the adrenal cortex to release aldosterone. So when aldosterone is released, it acts on your kidneys to help retain sodium. And if you retain sodium, then you retain water, which also keeps your blood pressure elevated. So ultimately, the effect of this renin-angiotensin-aldosterone pathway on your body during the stress response is that your blood pressure should be elevated as a result. Now, part of the RAS also includes antidiuretic hormone. So angiotensin 2 can act on the cells of your posterior pituitary gland to stimulate the release of antidiuretic hormone, or ADH. We also call this vasopressin because it's a vasoconstrictor. But ultimately, antidiuretic hormone also has an effect on your kidneys, and that effect is to help your kidneys reabsorb water from urine back into your bloodstream. Actually, this should say filtrate, not urine. But it prevents water from being lost into urine. That's why it's called antidiuretic hormone. So ADH would cause you to have a lower urine output, but by retaining more water, you also keep your blood volume elevated, which keeps your blood pressure elevated. So this question here says, true or false, antidiuretic hormone increases urine output. And we just learned that that's false because antidiuretic hormone actually stimulates the kidneys to reabsorb water. So you actually would decrease the volume of urine that's being produced. So this scenario here says, after an accident, a patient has the following. So increased heart rate, low blood pressure, no urine production or bowel sounds, pale, sweaty skin, dilated pupils, and elevated blood glucose. And all of these signs and symptoms are associated with the stress response we just talked about, how your sympathetic nervous system can lead to an increase in heart rate. And through vasoconstriction, you can decrease urine output. And because your sympathetic nervous system inhibits your digestive organs, you also see a lack of bowel sounds. Pale, sweaty skin comes from the sympathetic vasoconstrictor response, as well as sympathetic activation of your sweat glands. Dilated pupils is also a sympathetic effect on your pupillary diameter. And elevated blood glucose occurs with the release of cortisol and the sympathetic response to that. So this question, though, says, what should be fixed first in this patient? And this ultimately boils down to which of these is the most life-threatening for this patient that had an accident, and so that should be fixed first. So obviously the pale, sweaty skin is not that important. It's okay if skin is pale and sweaty for a little bit. Same with dilated pupils. That's not that important either in terms of fighting for your life. Having elevated blood glucose is actually a good thing in this patient's case because you want to be able to provide your cells with energy to undergo metabolism to keep those cells alive. And the fact that they're not producing urine in the short term is not a problem, but in the long term, you're going to need to have normal urine output. The fact that they're not digesting really currently, so there's no bowel sounds, is also not an immediate life-threatening problem, but ultimately you'd want to have normal digestion restored. But the most life-threatening problem would be this cardiovascular response. So the increased heart rate and low blood pressure is putting a lot of stress on your heart, but the low blood pressure is also preventing adequate delivery of nutrients like oxygen, and also the removal of wastes from tissues like carbon dioxide. So maintaining normal blood pressure would be the thing that would need to be fixed first, and then followed by other things that are more vital for your long-term survival, like producing urine and digesting. So in terms of the effects of the stress response on your immune system, we talked earlier how cortisol depresses the activity of cells in your bone marrow, which not only prevents the production of red blood cells, but also prevents the production of leukocytes, which are white blood cells and involved in your immune response. So your immune system depresses immune cell production. It decreases activity of the thymus, which is where T cells mature, and it also can change the types of immune cells that are produced. So it can alter, the types of leukocytes that even are produced, which can put you at risk for certain types of infection, depending on which types of cells aren't produced as frequently anymore. So this question here says, how does the stress response affect your immune system? Does the thymus atrophy? Do you find fewer lymphocytes? And do you find the release of inflammatory mediators? And the answer to this is actually all the above. So we haven't mentioned inflammatory mediators yet, but one of the things that's important to note, though, is that during the stress response, because you get the release of inflammatory mediators, that can actually lead to long-term damage of tissues as well, and that can lead to interesting disorders that we'll talk about in future chapters. So in terms of adaptation to stress, there's lots of different variables here, right? So we know that not everyone deals with stress the same way, whether they deal with that psychologically or physically. Ultimately, adaptation depends on all of these factors here. So time is a major variable. Sometimes it just takes an adequate amount of time in order for your body to deal with a stressor. There's certain genetic factors too, like you might be genetically more hardy to adapting to a certain stressor, or less hardy if you have a certain genetic condition. There are age-related variables as well as gender-related variables because of sex hormones playing a role here. The age-related variables would correlate with the general activity of your organ systems. So as you get older, it's more difficult to deal with stressors, which can also often lead to death as well. Your current health status as well can play a role with how well you're able to adapt to stress. Nutritional factors, how much sleep you've had, because we talked about sleep as having an antioxidant and restorative function on your body's cells. Psychosocial factors like psychologically, are you able to deal with stressors and undergo the activities that would help to sort of psychologically lead to a lower amount of stress? Or are you more prone to stress because of certain psychological problems? And then this idea of hardiness correlates with really all these factors here, where hardiness is sort of the sum of all these factors. And so it's the sum of your genetic, age, gender, health status, nutrition, the amount of sleep, as well as psychosocial variables that can all play a role in how stress resistant you may be. Now, with acute stress, this is what we're talking about is sort of short-term stress. So with acute stressors, this question here says, which organs of the body would you expect to see damaged by acute stress? So with the acute stressors, you're thinking about the organs that are playing a role in the acute stress response. So short-term, rapid stress response. And when you think of rapid stress response, think of sympathetic nervous system. And we talked about how your sympathetic nervous system can decrease blood flow to the kidneys. So if it's strong enough, your kidneys could not get enough blood flow, so that could lead to kidney damage. But really, in terms of the organ system that's mostly affected by acute stress, it would be your cardiovascular system, which includes your heart and your blood vessels. So because of a higher blood pressure during the stress response, it's going to put excess stress on the blood vessel walls, as well as your heart to overcome that blood pressure. So acutely, it's going to put more damage on your cardiovascular system. So in terms of long-term stress, we're talking about chronic stress. Sympathetic activity and cortisol levels are elevated, although the sympathetic activity in the long-term stress response isn't as high as it is in the acute response. And there's also complications that can result from a decreased immune response. So we said that cortisol prevents the proper production of lymphocytes by your bone marrow, as well as maturation of cells in your thymus, so that over time you can be at a higher risk for infection. So if you wonder, where do you find a lot of bacteria and where are you at a higher risk for infection? Well, think of really just any mucous membrane along your body, whether it's like the gastrointestinal tract, the genitourinary tract, your skin surface barriers can be compromised, and ultimately it can make it more difficult to heal wounds that may also occur during the stress response. So psychologically, though, we can have something called post-traumatic stress disorder, or PTSD. So post-traumatic stress disorder can come from, a psychological stressor that may have occurred at some point in someone's lives. And in order to have PTSD, they have to have a strong stress response in the absence of a stimulus, like up to 6 months later after the initial event. And so what we find here in PTSD is that cortisol levels are lower than you'd expect to see with normal stress, but they have general overactivity of their sympathetic nervous system. So it's almost as though their nervous system is primed and ready for their fight or flight response. Their blood pressure is going to be higher, quicker heart rate, more epinephrine, norepinephrine in their bloodstream. You're also going to find lower urine output, so higher blood pressure, accumulation of certain wastes, and a lot of stress on their cardiovascular system. And so post-traumatic stress disorder is common in people that have had some sort of traumatic event at some point in their lives. So this scenario here says Mr. P saw violent combat in the Army, but he dealt with it and has become a successful air traffic controller. He's 50 and overweight with high blood pressure and occasional tachycardia. He suffers with insomnia, GI discomfort, and several colds already this year, and he wants a flu shot. So the question here says, what about his case might be stress related? If you look at these particular signs and symptoms, are any of these stress related? And really all of these would be stress related, right? We talked about how blood pressure is correlated with the stress response, especially the sympathetic nervous system. That would explain the tachycardia or fast heart rate as well. Insomnia could come from, just overactivity of the sympathetic nervous system response as well, such that they're not able to calm down enough to sleep at night. You're going to see GI discomfort because of sympathetic inhibition of your digestive organs, as well as several colds this year because of a decrease in immune system response. So it kind of would make sense then that this individual may be suffering not only from the long-term effects of violent combat in the Army, but also the stress that's associated with the job of air traffic controlling, because you're sort of managing many different things at once, and the stakes are high because people's lives are on the line. So all of these can lead to stress. And the fact that he's 50 and maybe a little older could also be an age-related variable to not being able to overcome these stressors, and that can put him at a higher risk for all of these particular signs and symptoms. So the doctors recommended relaxation therapy, and Mr. P is furious about his new age gobbledygook. So how would you explain its psychological basis to him? Well, we learned earlier how the stress response that can lead to physical manifestations could also correlate with the nervous system, specifically in your hypothalamus. So if you remember, the hypothalamus was involved with the visceral responses to emotions, like psychological stress. And because the hypothalamus can release CRH, which can lead to the production of ACTH by your anterior pituitary, then you can get the release of a lot of cortisol and gonadotropins, which can have sort of stress-related changes to your organ systems. So when you start talking about the physical manifestations of stress, it can correlate with and boil back down to what's happening in your brain psychologically. So those two things are connected. And so the idea here behind relaxation therapy then would be to calm the nervous system psychologically and consciously through whether it's meditation or different relaxation techniques, just engaging in hobbies that one would enjoy, ultimately to retrain your nervous system to be less stressed and not be as sympathetically active as often. And so over time, the idea then is that relaxation therapy can lead to physical changes that can lead to proper health and normal balance across your organ systems.